So show me the spots on this foot that hurt. Right here, okay, and then right here. I've always been an athlete, always been fascinated by the dynamics and function of the human body. And so that aspect of medicine was always much more interesting to me. And just the kids are great. Kids just want to be a regular kid out there running around with other kids. And so that kind of clear motivation is really refreshing. So I just gravitated towards pediatric orthopedics really from the beginning. I'm Susan Mahan. I'm a pediatric orthopedic surgeon at Boston Children's Hospital. Hello.
Hi.
How are you guys doing today?
Good.
You ready to get this done?
Yeah,
Awesome. And then the big question is, how's your stretching been going?
pretty good.
Good? You optimistic? Relax for me? Fantastic. Good job. I specialize in pediatric foot and ankle disorders as well as some lower extremity alignment issues, whether it's, club foot, tarsocoalition, cavus foot, flat foot. Every patient is unique, not just that every foot is different because every foot's then attached to a child, and that child itself has a particular thing. Maybe this kid wants to play soccer and this kid wants to play the violin, so what they need for that foot is going to be a little bit different. So for every kid, I'm trying to figure out what the problem is, what they're looking for that foot to do, and coming up with an individualized plan for that patient. Pediatric foot and ankle care is becoming more and more minimally invasive based. First off, we try and avoid surgery altogether when that's possible. But when surgery is needed, instead of making big incisions that need big recoveries, we're trying to make smaller incisions. So whether it's the bunion correction, the minimally invasive flat foot correction, when you have to do a foot reconstruction, there's some minimally invasive options even for that. So my hope is to continue to treat those patients here at Boston Children's, but also working on sort of more of an educational mission to try and bring more surgeons into the fold into using this technique across the country. All right, can you walk back for me?
Yeah.
Yeah, so she's not really letting that heel hit the floor at all, is she?
No.
I have always been actively involved in clinical outcomes research and always have something going. But also I'm starting to try and mentor the next group of young surgeons and to bring them forward into the comfort of that research space. With research projects, you can potentially treat generations with some improvement of something. So it's in that sense, it's really very powerful. So I think these are too tight. There you're in. You feel how you're in now?
Yeah.
Yeah. My hope for my patients is that they can go back to being as active as they want, pain-free. There's really very few things that are as rewarding as that. And then seeing something like the minimally invasive surgical techniques taking off when I've got providers around the country saying, hey, how do I learn this technique? Do you see something that you fostered take on a life of its own and starting to be a bigger deal than just what I can do one patient at a time? That's super rewarding as well.